Hello cruel world, my name is Dr. Sohom Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders so you don't have to. This video is about what makes a good psychiatrist. So what are the character traits of a good psychiatrist? And I've got 5 altogether. Trait number 1, listen to the patient. Now that might sound obvious, but some psychiatrists that I've worked with really do struggle. So for example, you have to really get down to all the side effects and all the symptoms that the patients are complaining about, not just the ones that you are most confident about treating. And you have to work together with the patient. So instead of just telling them they need to be on this and this medication, try and really come up with like an agreement. So change doses carefully, look at side effects carefully. Obviously this also depends on the environment. So a psychiatrist who's in an outpatient clinic is likely to see patients who are relatively high functioning and they have the capacity to decide on their medications, whereas typically psychiatrists who work in a hospital, so that's the inpatient setting, might work with people who are detained under the Mental Health Act, so they don't have the ability to make decisions. But to really understand the patients, it involves sitting back, shutting up and listening. I remember working for one particular consultant when I was a junior doctor who was so narcissistic that she would spend entire ward rounds just going on these rambling sort of psychodynamic theories about the patient's behaviour, which was not helpful because first of all she'd repeat herself almost every week, and she'd do this at the detriment of actually making decisions, which is what she was there for. And it was infuriating for me because I needed to know what to do to help the patients, and she would barely ever address this. Trait number 2 is to have enough time for the patients. So most psychiatrists that I see are kind of rushed, and the reason is because we've got so many responsibilities going on behind the scenes. So as well as typically seeing people in clinics and also in inpatient hospital settings, there's lots of extra admin stuff we have to do, from writing reports to going to management meetings to training junior doctors to mandatory training ourselves. There's just a whole lot of stuff to do, and sometimes a lot of psychiatrists are very rushed, and especially in inpatient settings where the patients are there for a longer period of time, I've certainly seen consultants that come in and barely spend any time with their patients. And I remember in particular working for this one consultant when I was in Australia who was so lazy that he wouldn't walk over to the other side of the site of the hospital. It was in the huge grounds, and it would take like 10 minutes to get to one small ward where he occasionally would have 1 or 2 patients, and he very rarely went over there, and I'm pretty sure it's just laziness. And it's very frustrating for me because I needed his help to make decisions and to give me backup for my clinical judgments at that time. I should also say that I'm quite aware that I'm slagging off a lot of psychiatrists in this video. By far I've worked with more good psychiatrists than I have with bad ones, but I think the bad ones are more helpful in teaching me what not to do. Trait number 3 is to listen to your team. So sometimes in front of the patient, like in ward rounds, or often not in front of the patient in separate meetings, lots of the different disciplines get together. Psychologists, social workers, psychiatrists, junior doctors, nurses, and they all have opinions and aspects on the patients. So I'm talking mostly about inpatient hospital patients here. And I've certainly worked with consultants that pretty much ignore what their team is saying and their team's opinions and just do what they want to do, which I think is wrong. And it demoralises the team. It makes them feel that their work is unappreciated and pointless. Having said that, at the same time, you need to be able to control a ward round and know when to get certain people in the team to speak up and contribute more versus sort of shutting some people down. So I've certainly worked in ward rounds where you have 1 or 2 very dominant members of the team who have lots of opinions, and whereas they are welcome, there's got to be a point where they just shut up and take a back seat and let other people give their opinions as well. So there's a fine balance in doing it so that everybody feels that they're listened to. And also, if you don't go with somebody's opinion or recommendation, I think it's really important to explain to them why. So I like your idea, but here's another approach, and this is the reason we should go for this one. And I've definitely seen some consultants do that very well and some that don't do it at all. But the consultant needs to take ultimate responsibility. So the psychiatrist heads the team, so we have to be able to take the risk and responsibility. So to give you an example, I work with mentally disordered offenders, so at some point in their rehabilitation journey they need to be allowed to have leave. You can't discharge somebody into the community unless they've been tested on leave. but when is that point? For some patients it's really easy, it's quite clear because they're settled. Some patients constantly push boundaries or have some aggression on the ward. So at some point you've got to bite the bullet and take a risk and give them a little bit of leave. So this is a kind of scenario where there'll be lots of different opinions, and you've got to make the decision, and you've got to stick with it. You've got to take the consequences. Trait number 4 is staying up to date with local psychiatric knowledge and treatment. So it is relatively difficult to become a fully qualified consultant psychiatrist. You have to jump through loads of hoops, loads of really tough, grueling and expensive, I should say, exams with very low pass rates. So to actually become a psychiatrist is quite difficult, but once you're there, it's quite easy to rest on your laurels and not learn much else. So to get the membership of the Royal College of Psychiatrists in the UK, you have to show that you do a certain number of hours of continued professional development, so that's 50 hours. But you could do that kind of in a very laissez-faire way. You can just go to conferences and not really learn anything. So what I'm trying to say is that a good psychiatrist will continue reading journals, he'll learn about new medications, new definitions of disorders, even new services within the localized area. Whereas a bad psychiatrist just kind of takes what they once learnt and just keeps that same knowledge set for 10, 20, 30, 40 years. And I've definitely seen that. And the 5th and final trait that I think makes a good psychiatrist is knowing your limits. So knowing, not when to give up, but knowing when you've done the best that you can do. So a good example of this would be if you've got somebody with a retractable, which means untreatable depression, and you've used lots of antidepressants, there's got to be a point where you decide that this is the best the patient's going to get. The alternative is that you constantly throw different medications and different dosages, and at some point all you're going to do is give them lots of intolerable side effects and they're not going to feel better. Whereas it's more sensible to reach an acceptance, and that acceptance will vary in different patients of what's tolerable to them, to know that this is the best you can do. Another example is to know when to refer on to another agency. So I remember seeing a patient in a medium secure ward who was under my care, who would have these intense psychotic kind of episodes that only lasted like half an hour. They were very strange, and he would act extremely bizarrely. He would bite down on his own hand, he would kind of spin around on the floor with his eyes open. I just generally didn't know what the hell was going on. I tried lots of different medications, antipsychotics, and they made no difference. And then eventually I made a referral to a neurologist who diagnosed a very unusual, very rare form of epilepsy. And it didn't look like epilepsy to me. So had I stuck to my guns and been narrow-minded and pig-headed, I'd never have made the referral, and he wouldn't have been medicated appropriately, which is what happened in the end, and he would have stayed unwell forever. I've got a couple of questions for you, dear viewers, but before then I just want to introduce you to this channel. This is a Psych for Sore Minds. It dissects a whole range of mental health issues, a lot of which are related to offending and violence, because that's my specialism, but a lot of the episodes are about general psychiatric mental health issues. I do a whole range of videos, from interviewing ex-patients to talking about specific diagnoses to telling you about high-profile cases with a mental health element. There's something for everybody on this channel. So my questions for you are: have you ever had a particularly good or a particularly bad psychiatrist? And if so, what was his or hers behaviours, attitudes and traits? And finally, do you think there's anything that I've missed off that is more important than my 5 in terms of making a good psychiatrist? Okay, hope to hear from you soon. See you on the next video. Stay 𝐕𝐢𝐝𝐞𝐨 𝐬𝐢𝐽𝐵s, and until next time, remember, I love you.